On the form you filled out, you said you regularly drink.
And here comes the lecture in 3, 2, 1.
I don't want to lecture you. It's just really dangerous for someone your age. I mean, look at what happened today.
Oh my God, you're right. It'll never happen again. I'm so glad you were here to set me straight.
This new computer simulation shows how difficult it can be to get teenagers to open up about substance abuse. It's being used as a training tool for healthcare professionals to change the way they identify a problem and to intervene.
Joining us now to talk more about this is Dr. Michael Dentato, Associate Professor in Loyola University's School of Social Work. Thanks for being here.
Thank you for having me.
So is the idea that you sit a kid who might be already have a drinking problem down in front of a computer screen, say, watch this cartoon? It's got to be more to it than that.
No, absolutely. Yeah. It's actually for professionals in the community. So we use Kognito specifically to train students and community-based professionals on how to effectively screen youth and adolescents for risk of alcohol and use. So it's really to effectively prepare the workforce in order to intervene and provide services throughout the community.
So we saw an example there just in the intro. Walk us through how the simulation works.
So it can happen in between 60 to 90 minutes. You sit in front of your computer either at home or at work, really comfortable, less stress, less anxiety than sitting in front of an actual patient. You go through 3 different simulations of youth that are in an emergency room for excessive drinking, right? So one example is a young man who falls off a porch and he's got a cast on his leg, and you start the screening process by which you determine what happened and how often and how frequent has this youth been using alcohol. Based on his response, you then ask other questions. So it provides a platform by which you can make mistakes.
And this is helpful for parents, I would assume, if they wanted to, because teens, I have teens. Not easy sometimes to talk to about what they don't want to talk about.
Right. Not easy to talk to quite often, frankly, right? Yeah, so not only does it effectively prepare the workforce, but when parents are in need and they've got a youth or an adolescent who is struggling with alcohol or drug addiction, they typically turn to support, right? So they're going to reach out to agencies and to mental health clinics and substance abuse clinics. So we've got people trained, effectively trained via Kognito. They make the link with their parents that need help for their kids. We get those kids into care when needed.
So you're well aware of the opioid problem, you know, in the Chicago, across the country, in the Chicago area, DuPage County, where a lot of teenagers, you know, have the injury, they get prescribed some painkillers that leads to a heroin addiction. Can this be used? You've said alcohol a bunch of times. What about specifically for, you know, opioids?
Absolutely, yeah. Anything that we can do, and again, through using platforms such as Kognito, to look at ways to screen those that are at moderate risk or potentially at high risk for opioid use is certainly going to help impact, you know, what's going on out there. So it is effective not only for those at risk for excessive alcohol use, but clearly for other drugs as well. And we well know that, you know, many youth and adolescents are struggling not only with alcohol addiction, but with tobacco use and with marijuana use and clearly with opioids as well.
Give us a couple of tips you can give to parents who might be struggling, or maybe even teenagers watching. What do you say to your kid? Because kids are, you know, they're going to be like, it's what my friends are doing. It's this, it's that.
Yeah.
What's the biggest mistake parents make, and how do they make that change?
I think the issue quite often pertains to shame and to stigma, that parents feel like, you know, oh my God, what do I do? Who do I turn to? And I think the big message is to know that they're not alone, that there are many kids that are struggling with alcohol and substance use, and that there are services out there that can help support them. So I would say the biggest message is to realize that you can reach out for support, and that there's so many different services out there that can provide support for their kids or for the entire family.
You said services. I'm sorry. My wife works in addiction treatment, and a common theme among people in addiction treatment is that most of the best treatment out there is unfortunately only available for families that can afford it, because so much. If you're a family that doesn't have the resources to send to, you know, a Hazelden or you know, a really high-end treatment center, and you have a teenager that's struggling with addiction, where's the best place for some of those families to start?
There are many services that are either low cost or free throughout our city. One great website is ChicagoConnects.org. That's through Chicago Department of Public Health. So that's a great portal in which they could look at the variety of services that are available. Again, either at low cost or no cost throughout the city.
Okay, and you could thank you, Dr. Donato. For more information, you can check out luc.edu/SBIRT. It's just that simple.
It is. Yeah.
It's right on your screen, though, or you can go to Kognito.com. Is that right?
Correct.
Thank you so much for being here.